Hello, everyone. I am so delighted to welcome my friend Roshan Pais. We went to our internal medicine residency together at NYU, and after so many years, today I have the pleasure to having him come and join me for this meeting, an informal way to reconnect long-term friends. Roshan, welcome. Thank you for joining.
Thank you, Farhan. It's my pleasure. I'm so glad that we reconnected through, of course, social media, and now we are back again discussing about our lives.
Roshan, you are absolutely right. When we were together in our during our residency, that was in
Yep.
2004, and we were there 3 years together. We
Mhm.
graduated in 2007. And correct me if I'm wrong, the social networking connections were not as strong at that time.
Yeah, the social media was just beginning. I think all those Facebooks, Twitter, and Instagram were not even there at that
Exist,
time.
yeah.
Yeah.
We are aging ourselves, but be honest with you, last 10, 12 years have changed how we conduct our business on day-to-day basis, right?
Absolutely. Yeah.
You
Yeah.
guys had a Google page. You and Asia were the main players behind it, and I think Manisha was also part of it. Is that true?
I think Manisha started. I think it
Manisha
was
started it. Yeah,
Yahoo
Yahoo
page,
page.
but
That looks old
that,
now, right?
I know it's not that user friendly.
Yeah. Well, I have a lot of questions for you because you are one of those people that I admired a lot in my training.
Thank you.
There were times when I came and talked to you and got a piece of wisdom, but it was always in a package of humor. You present things to your friends in such a light way, in a way that makes a big problem look smaller. So I always admire that feature of your personality.
Thank you.
So my questions are going to go back into your life a little bit. Part of life that I may not know, starting
Sure.
in your medical school. We didn't go to medical school together. So tell me, my first question for you is, why did you become a doctor?
That's an interesting question, and I have thought about it for a long time. But to be honest with you, I'm going to tell you the truth. I am very, very glad that I'm a physician right now. But when I was growing up, that was not my choice of profession.
Oh,
Believe it or
really?
not,
Hmm.
believe it or not, I wanted to be a physicist, like physics.
Physicist.
Yeah, I mean, you won't believe. Because, I always, growing up as a child in rural India, I was looking at the stars, the universe, and I was very scared to go to the doctors, the dentists. So my dream was to become a physicist and know more about these stars and universe. But what happened was when I was in college, I did not, because I did not want to be a doctor at that time, I took non-biological majors. Halfway
Mm.
through my college year, my uncle, who is my godfather as well, said to me, why don't you take some biological majors as well? So you still have time to think and do what you want later on. You want to go to, physics or medicine and stuff like that. And I excelled, I was kind of above average student, and I did very well in college. And when I was ready to get out of college, I got into medical school, engineering, and also graduate studies in physics. So
So
at
your pre college or pre medical school education was pretty diverse.
Yes, I mean, you could take physics, chemistry, maths, biology, but if you have to be a doctor, you have to have biology as one of your majors.
Okay. That's very interesting. It's different than where went to school in Pakistan. We had to decide right after our 10th grade if we want to do pre-engineering or
Mhm.
pre-medical. So
Yeah.
I left mathematics at 10th grade, and I have to pay the price when I have to admit it in front of my wife because she said that you don't know anything about mathematics. I'm glad you did not had to
I took
suffer
some
that.
math.
My next question is, where did you go to school? Your medical school, I mean.
So what happened after I got into engineering and medical school, and that's when I gave into my parents' hopes and my family's hopes.
Yeah.
That's when I chose to become a physician and go to medical school. Um, and coming from Asian families, just like Oriental families, we tend to agree to whatever our parents say. They said we
Yeah,
don't.
we admit that our wisdom is not good enough. We don't have that foresight, and maybe they know better than us. And I have the same,
Exactly.
yeah, same
So,
feeling.
so, so they said, we don't even have a doctor in our family, even the extended family. So I was
Oh,
like, why
really?
don't you be a trailblazer and become a doctor? I said, thought about it. Yeah, maybe that's what I will do. And then after I joined medical school and I graduated, I was so glad that really was my turning point in life.
Wow, that's very interesting. I have to say that sometimes our inner nature, our parents can see it a little bit better than what we can see. I did not know what I liked, what I did not like until I, until very much later in life. So I think you did the right thing. Now it is very different for us to tell this same to our kids because we are not sure what is right or wrong. At least our parents could tell us, go ahead and do it.
Yeah,
Um, now
absolutely.
you chose internal medicine and then you pursued your career to develop further in internal medicine. But I saw your depth of knowledge in every field of medicine. Within medicine, my question is, why did you choose internal medicine? And number two, why did you stick with internal medicine when you were one of our smartest classmates and you could have been a cardiologist, a pulmonologist, critical care, anything on earth?
I don't think I was smarted. Probably I was the more older among us residents.
Uh, y-
I am older
You
because
look, you still look younger than me, my friend. So don't
thank
pull
you.
that
Thank
card. It's not gonna work.
Thank you. No, I am by age wise because Farhan, before I came to the US, I was already an attending in internal medicine and neurology in my university where I went to school.
Interesting. Okay,
Yeah.
now it's coming back to me that you were practicing. So tell us a little bit about that from your medical school into early career.
So after my medical school, I did well in medical school, and then immediately within a month or two, I got into residency.
Hmm.
And I had several choices. My couple of choices were orthopedics or internal medicine. They call it general medicine because it's internal medicine and neurology combined residency.
Interesting.
So eventually, what? I'm a fun loving guy. I don't want to work, do surgery when I'm 60. I want to wear a tie and talk like this.
Yeah, I hear you. I hear you. So that's a good reason. I
So
completely agree.
I said internal medicine is like it's a
It's a
big
lifestyle.
knowledge. You learn a lot and learn about everything. So I like that aspect, and you think a lot, you learn a lot. So I chose internal medicine, and it took me 3 years, just like here, internal medicine and neurology residency in Manipal University. It's a big university in India, ranks around maybe the fourth or fifth in India.
So are their call schedules are similar to our call schedules here in United States? Or is it
They're
harder there?
similar, but they're probably a lot longer. And
A lot longer, yeah.
yeah,
You remember when we were almost at the end of our residency, our program was being evaluated for longer work hours for interns, and at that time, a lot of senior doctors who had trained, they said, "How come the doctors be trained if they are restricted to work longer hours, right? Because
I,
you have to
I tend
grind
to
them
agree
through."
with that. I come from an older generation. We all come from an older
Yeah,
generation. So I tend to agree with that. But sometimes there are some cons on that
Yeah.
about patient safety and quality, and we need to take care of those things as well. It has to be a fine balance,
Mm.
definitely.
So tell me a little bit about the course of your life as a physician. Any unforgettable patient encounter, or an encounter that can enlighten us or maybe make us laugh or smile from your experience?
um, there are several, but I don't think I want to elaborate them here. But it's there are a lot of moments in your life as a physician after you've been in the field of medicine for more than 20 years, that you have gone through a lot of disparity and despair and humiliation, whether it is a patient that you cared for dying in front of your eyes,
Yeah.
or a professor or an attending deriding you or humiliating you in front of your colleagues. There are multiple incidences like that. I tend to forget those bad or negative incidences. In a way, it taught me to look at life differently and to how to treat fellow human beings. In a way, I grew a thick skin to say, and look at that life differently. And I would suggest that to others as well, to uh, change the view of life.
So, as we were talking earlier, one of the things that I learned from you as your close friend is to take life not too seriously all the time. And
Absolutely,
that
that's
is one
right.
of my problems. And I think many of us. So, give us a tip of how you grew the thick skin, or how did you learn to actually make life, don't take it too seriously. Just shake it off.
you know just like every other thing or every other trait in life, it's both nature and nurture. I
Yeah.
think I was fortunate to you know be born as a happy-go-lucky
Yeah.
guy,
Yeah.
and sometimes you cannot cultivate that. I think I got that trait from my father. So but then you develop these skills as you grow older. Life is not always rosy. It's
Yeah.
like ups and downs. It's how you deal with those, both ups and downs. How you deal with those is what makes life worth living.
Beautifully well said. Give me a example of how you use this your personal trait in your day-to-day encounters with your patients. Do you ever give them this sense of light-heartedness? Can you give them so that they can carry that message with you along with your prescriptions to make their life better?
Sure, sure. As I said before, let me be self-indulgent here for a second. For some reason, again, I have that trait of being a people's person.
Yep.
I sometimes am amazed how people confide in me and trust me. And it is a burden on me sometimes, I tell you,
Yeah.
to keep that trust. Same thing with patients, families, and also my colleagues. So I do have funny way of talking and dealing with patients. Even in some difficult situations, I try to lighten the moment. So that helps patients also. It makes being smile on their face. And whatever the sorrows that we are going through or gone through in the past, in my day-to-day life right now, all I get is the gratitude, the smiles,
Smile.
and offers of prayer from my patients and their families that far outweighs any sorrow that I have.
Beautiful.
Yeah.
Oh my gosh, Roshan. Uh, Let me ask you the question now. I can see the gratitude in your voice, in your eyes, and how thankful for you are. So, is this a dream job for you? Is this all is a dream?
That was my opening statement to you. I said, I am thankful that I am a physician,
Yeah.
and I'm in the service of people and patients who are suffering. Yeah, it's my dream job, no doubt.
What is the most attractive feature of this current job? I know you are a lead hospitalist and you've been in Richmond, Kentucky for almost 13 years. I think the
Yeah.
last we spoke, you this is the only job you had since you left. Am I correct?
Yes, yes.
So so you never changed this job? All of us
Before
have
I
went through
joined,
at
I
least
did.
three, four jobs.
No, before I joined for 2 years, Farhan, I just did part-time positions for 2 years. We, in our profession, we call that locum
Yeah,
jobs,
you
precisely
did
for
that?
the precisely for the reason that I wanted to look at different things, different places, and then decide on one. After 2 years of research doing that, I liked this place, and I'm here ever since.
Oh my God, this is such a good advice. Be
Yes.
honest with you,
And
you were
if you can,
if you
in your
can, but it tells me that you know how sometimes it is better to not jump on one decision and then regret it. And I was not ever thinking about that when I was always eager to like start what I thought was right, but then later on thought, okay, it might have been a better if I actually slowed down a little bit and thought about it. So location wise, Kentucky is not the place that comes to mind. How did you end up in this location?
so as I told you, I grew up in a small village in India. In
Okay.
fact, I had to walk 5 miles to school one way.
5 miles.
Yes, because it was a small village, and I love the open space and nature, and that's why I like Kentucky. It's a bluegrass state, beautiful, open space,
Yeah.
mountain, and that's why I chose. And regards to why I chose hospitalist after finishing our residency is for the work-life balance that it gives you. So I have enough time to spend with my family or to have enough time to indulge in my hobbies. So
Yeah.
so that is one reason why I chose
I'll
hospitalist.
I'll I'll ask you a little bit more questions on it.
But
My
just to clarify on listeners, hospital medicine is a branch of medicine that takes care of acutely ill patients in the hospital, whereas primary care physicians or family physicians take care of chronic problems.
chronic problem.
Of course, there are physicians who do both. So hospitalist or hospital medicine specialists are those that take care of patients only in the hospital setting. Just to
Thank you
clarify.
for clarifying that because this field is grows growth had a significant growth in the United States, but not in any other
Sure,
country that especially our listeners might be from.
sure.
So that's a good idea for. Um, you have probably seen all type of critical illnesses from neurologic diseases to cardiovascular diseases. And is there anything that you don't like dealing with that kind of patient that you like, it's just a bigger challenge for you intellectually?
Um, I do not have any problem in dealing with any kind of uh, system, if you say about cardiology or
Yeah.
neurology. But sometimes people don't only come with somatic symptoms. In
Yeah.
fact, most people have a functional component, what we call as psychosomatic component.
Psychosomatic. Yeah.
And sometimes treating those patients who have a bigger component of psychosomatic issue, it sometimes is frustrating to treat these
Yeah.
patients.
And sometimes social issues, right? A patient comes
And
in,
social issues, yeah,
uh,
that
they
actually
fall at home,
psychosomatic
they don't
and
have any.
social.
Yeah. So in hospital settings, I think that's a biggest challenge sometimes to make sure that they are safe at home to go home. They have food at home, medicines delivered. So that's a big part of hospitalist job, which is very challenging and takes a lot of strength to work on those problems,
Sure.
character strength and moral strength. 5 years from now, Roshan, what would you like to say? I did this, and I'm really proud of it. I can give you a suggestion. You know a lot of doctors coming to you, giving them secrets. Maybe create with fictitious names a book about what they have told you.
um, I don't know. What I like in the future is go probably more into quasi administrative and quasi mentoring, like medical school and mentoring residents and students. I like to teach. As you know, I
You
was a
are,
veterinary
yeah, yeah. You are a
engineer.
good teacher.
Yeah.
You are,
So and
and I, um, you have any medical school close to your work
we
currently? You,
do, and we do have students rotating in
okay.
my hospital.
So we talked briefly about roadblocks of hospitalist life. Tell me, just broadly, any roadblocks of your day-to-day life that you will like to overcome or see that taken care of?
Honestly, maybe the way I am as a human being, the stress of my day-to-day life, day-to-day work life, does not bother me much. You asked me earlier about, is it commute or family life or stress. I don't think so. My commute here is maybe less than 10 minutes, 5 minutes to work.
Beautiful.
So I spend a lot of time with family and friends. So that way, the work stress is not that much. But because I am a lead hospitalist director here, so sometimes that may be the only stress I have of managing the administrative duties. Uh, other in clinical work, I feel like we all are aging, and that may be a lot of stress because it's a lot harder nowadays to do long shifts, especially at night.
Yeah, so hospitalist, if people don't know, it's a 12-hour shift straight, and you do 7 days in a row. And sometimes you might have to go on your off week to administrative work to do and check on things. So you have really long hours. You work almost more than
That's true.
80 hours a week when you are in the hospital, and that's very stressful, physically, mentally, and your family feels that you kind of abandon them, and you're, I don't know where you are. So
Yeah.
that's definitely, I agree with you. um, what made you mentally and physically stronger during these last years, since your medical school?
It's looking at suffering on a daily basis, like we all do.
Yeah.
And that definitely has made me stronger to look at back at my own life and how I have suffered and come out of it. So it's, as I said, it's your perspective as to how you look at things. You can just look at things and be depressed, or you can look at things and say, I did it. I know I conquered it. I came out of it. So that's what happens every day in my life. I have patients struggling, and then I take care of them. They feel better. So like that's very, you know, good to feel, good feeling.
Yeah, Roshan, on a humbler side of life, have you ever failed in anything in your life that taught you a lesson?
Probably many times, Farhan. Probably
Yeah.
many times. Um, Even in India, I was trying for fellowship. It was hard to get, so I did
Mhm.
not. So and even in US, I tried for a year, but you know it
Failures are sometimes important for us to actually look back and see, who we
definitely.
become eventually.
Yeah, yeah. I mean, failure is part of life.
Yeah. And not getting discouraged is important too.
That's
Um,
true. That's exactly right.
mm, so another question I have for you is there a piece of, maybe an advice, a quote that you would like to share with us that you wish you knew when you were younger?
Oh, while doing medical school,
Yeah, during this life, during the life that you have now, in last maybe couple of years of accumulating or understanding the deeper wisdom of life and sharing it with your younger past?
Um, I know looking back, hindsight is always 2020. But I think when you look back, you always long for your dreams and you want to achieve uh, this thing, or you want to go in a higher education. You have all these dreams. But what you forget is actually working hard for it through the failures. And you don't realize that when you are young.
Yeah.
People think that things will come to them easily, and they don't. You have to work hard. And looking back, it looks like a beautiful movie of 1 hour, but it took 10, 15, 20 years.
Yeah.
So
Many
I think
times you
what
made.
my advice would be to, aim for something, but give it your best. Give it all you got. Don't expect for success or gratitude. And if you work hard, the success, the gratitude, the financial benefits will always naturally come to you.
Beautiful, very well said. We always have to think about our kids and how they want to achieve things, that they get frustrated and we want to tell them, but I think if it comes from somebody else, it has a little bit better value, that you have to think about it. You may make 2 steps forward but 1 step backwards all along the life until you get where you want to be. Thank you for sharing that thoughtful advice. Now my question is there a is there a group of people that you say, my heart goes out to them, I really want to see them prosper or in a better shape than what they are? Any NGO that you like to help or is close to your heart that you want to share with your friends?
Farhan, we all who are better off in life should give back to
Hmm.
society, to our community. I do my part. I am not, partnered with one particular NGO,
Hmm.
but I work with many. I do medical missions that we go to different countries.
Oh, you do?
But what personally satisfies me, gives me great pleasure, is when I help very bright but poor kids in my hometown, my village, who cannot go to school, and when I help. And that's what gives me the greatest pleasure.
So let me ask you a follow-up question. How do you reach out to them?
I have
How?
family in
Family.
India,
Okay.
so a village. Everyone knows everyone, so you know has a bright future and who cannot afford to go to college or school. Do my whatever little I can
Good.
through my family.
Yeah. Sometimes it's just being there, being letting people know that if they need a piece of advice,
Yeah,
you are there. I think I we value monetary donations more than intellectual contributions. But I have realized that if you ask a young person, sometimes they're happy to live in less as long as they know somebody can give you them directions.
sure.
So
You
that
said it very right. Most people in my experience don't expect, including your family or your friend, don't expect you to give them, money or
yeah.
monetary things. All they need is your love and your advice.
Yep. And I'm not quoting that um, a famous saying that don't give them fish, teach them how to fish.
That's
I'm
right.
just summarizing that, but I think that's what you were saying, and that's really a great idea. My last question of this our professional session of
Mhm.
the talk is about COVID-19 crisis. A piece of advice that you would do for us to handle these kind of crises in future. What do you think? What did you learn from COVID-19?
Yes, we all should and could learn a lot from any disasters. One thing we need to know that sometimes it is difficult to perfectly plan everything, our response, especially when you have a virus or a biological thing that you have never been immune to.
Yeah.
I know we, as a world, we have suffered a lot with loss of life with this pandemic. But I am always hopeful that we will learn from this, and that's another quality I have, is be optimistic. It did not, I'm happy that in Middle America here in Kentucky, we didn't have to go through the way New York went through, I am glad that New York City did not have to go through the way the Italy went through. So we should always be thankful to God, or to whoever you believe in, that we could have been worse off.
Yeah.
One thing I would say we could have done better, as a physician, I would say, if we had planned a little more early, especially on testing people, so that we I wish we could have been a little ahead of the game when it came to testing. But again, I am not sure how you can test or devise a test when you don't know the exact sequence of the virus. Of course, we got it sometime in January. I think that I would say we would have been little more proactive on that aspect. It could have helped us, really.
I agree with you. Everything what you said makes sense. That what I heard is you're asking that, um, proactively sharing the information about, um, globally, of identifying infections would make us respond better, because countries who responded better, like Taiwan or China, they have gone through some milder form of this
Mhm.
similar low level of infections, like in the form of prior coronavirus infections, SARS and MERS in Middle Eastern country. There are still people, the countries who suffered worse than ours. And I think that is also a point of us to stay positive. Um, and I think at future, maybe sometime we'll talk about how we have identified obesity and poor cardiovascular or metabolic health as a risk factor for COVID-19 that we never think. And I think it is a bigger problem in America, that we do have a lot of metabolic obesity related issues, right?
Yeah, we have to go. That we all need to educate people that we have to create health, not treat disease.
Beautiful, very nice.
Yeah,
Okay,
that's important.
for that, on that good note, we will conclude our professional session, and the next session is going to be a little bit lighter, and we'll talk a little bit about things that, Roshan, you do for fun, and I know you know how
I'm
to
glad the
party.
professional part is over.
Yeah.